Come in.
Hi there.
Hi.
Are you Miss Hanson?
Yes.
Hi, I'm Dr. Michael Morrow.
Oh, nice to meet you, doctor.
Good to meet you. I'm one of the breast radiologists, and I had a look at your diagnostic mammogram and ultrasound, and I'd like to talk to you about those results.
Oh, good, thanks.
Okay. Unfortunately, I have some concerning news about the findings that we see on these, the mammogram and ultrasound. There's something I'm concerned about.
Oh, dear. I thought it was just sort of a routine thing. I mean, when you find a lump.
Yeah, well, we always fully assess these to make sure. I mean, obviously, we're looking for anything that might be concerning.
Yes.
And there are some features of this abnormality that we're seeing that, excuse me, are concerning enough that I'm going to recommend that we biopsy them.
Oh, I see. So it's a possible cancer is what you're trying to tell me?
Correct, yes.
I'm just kind of shocked. I mean, I thought most lumps women find aren't, and I just thought I'd be in that group of...
Yeah, a lot of them aren't, you're correct, and it must be shocking and tough to kind of hear. And I'm not saying that it's cancer, I'm just saying that it's concerning enough that I'd like to, we'd like to take a sample of it to make sure that it is or is not cancer.
Yeah, I didn't even tell my husband when I found the lump because I was expecting good news.
Yeah.
And I was going to tell him after.
So he's not here with you?
He's not here.
Okay.
We have 3 young kids.
Yeah.
I don't know what they would do, what he would do if I had cancer. I mean, I want to be around for them. I'm just shocked.
Yeah, it sounds like it would be a big thing, a tough thing to deal with for sure.
Yeah, I mean, is the lump very big?
It's about 2 centimeters, which is a little less than an inch.
So that's tiny, so that's good.
Yeah, it's small. It's not,
Yeah.
it's not, 2 centimeters is small.
Yeah.
And once again, I'm not sure. These are concerning for me. We also saw an enlarged lymph node in your armpit region,
Yeah.
kind of in here. And so what we'd like to do is assess these further. Under ultrasound, we see it with ultrasound, so we can actually get a sample of the abnormality we're seeing in your left breast, and we can actually get a sample of the lymph node. I can talk to you in more detail about that. Just wanted to kind of present that to you to let you know what we would do.
Okay, so I just have to gear myself up for this. What else can I do if this is the reality? I mean, so is this something you could do today, doctor, just so I would definitely know?
I think we might be able to. I need to look at our schedule and see. So if we do this, it usually takes a few days after that to get the results.
Yeah.
It just depends on the pathology. Basically, we're waiting on pathology to come back with the results. But if we have some spots open, if not, we can schedule you for very soon.
If you could do it today. Now, is this something you would do?
I could, if you're comfortable with me. I mean,
yeah, I'd like that.
we might have to switch things around. I'm not. So we do have procedures. It may be difficult to get you in today, but I can see if we have any openings or cancellations.
Well, now I'm going to have to tell my husband. I don't know how to tell him.
Well,
I mean,
if you'd like to bring him, once again, I mean, if you want to, we can work to get this, but if you'd rather wait and come back with him and we can all discuss it together and do the biopsy all at the same time, if that's something that would be better for you.
Yeah, I might need a few minutes to figure this out. I'm just shocked. I mean, I'm only 45. There's no breast cancer in my family.
Mm-hmm.
I just figured, they're going to say, come back in a year and get your annual mammogram and do breast self-exam, that sort of thing.
Yeah, not what you expected at all, huh?
Not at all. I mean...
That's a lot to deal with.
And I know I shouldn't get ahead of myself and think, like, if I have cancer, but then I think treatment can be a burden on the family, and the kids are so little. I don't know how we'd deal with it.
It can be a lot to deal with, but, it's... The good news is that, a lot of cancers are dealt with and treated, and we have great medicine, and you know, if it is positive, but like you said, maybe don't put the cart before the horse, but, you know,
Yeah.
but, you know, the first step would be to get the ultrasound to make sure that's what it is, you know. This is concerning enough to me that I think it's okay to have this discussion and maybe to get yourself prepared,
Yeah.
because it is concerning to me. But, you know, I think that although I can try and see if we could fit you in today, if you'd rather wait and kind of, waiting a few days is not gonna change the course of treatment or the course of the disease.
Yeah.
If you think it'd be better to wait and talk to your husband and bring him, and that way you'd have that support, I don't know if it's something you'd wanna go through by yourself.
I guess, yeah, I was rash when I said just do it now.
Well,
It's
that's
like,
okay, I
If
mean-
it's not gonna change anything.
We can do whatever
It's
you
like,
like.
I need to know soon, I mean, I wouldn't wanna put it off weeks, but,
No.
I mean, I need to tell him first, I can't just rush him to the hospital while I'm having this
Yeah.
done.
We can get you in before the end of the week, but, you know, once again, you're the boss, I don't wanna,
Yeah.
if you wanna get it done today and talk to him after that, I mean, it's up to you. Either way, it's gonna be done,
I'll get done this
And-
week,
yeah.
by the end of the week.
Yeah, we can definitely get it done
That sounds
by-
good to me.
for sure, we can definitely get it done by the end of the week.
Oh, God.
Would you like to know more about what we do, or just wait till the day that you're gonna have it
Yeah,
done?
tell me, I mean, yeah, so what's with the lymph node thing? How do you even deal with that?
Well, the reason we would, so there's two things. The first thing we would do, you had ultrasound today, we would do the same thing and we would use a needle to get tissue samples from the abnormality that we're seeing in your breast.
Yes,
Then in addition to that, we were able to see a lymph node, and we would actually go get samples from that lymph node as well. So kind of two separate procedures, but at the same time.
and I
Okay.
don't have to obviously be put under
No,
general
no.
anesthesia or
We
anything.
do local anesthetic just right in your breast and in your axillary area,
Yeah.
where the lymph node is. And we get good control, we'll make sure that
Maybe
you're
under 2 minutes
under pain
remaining.
control, and we get those biopsied, and we get the results back from pathology within a few days, and that's where we'd go. But yeah, you don't go under, but you can have your husband come if that's something that you're okay with and would like, and he would like to be in with
Yeah.
you.
I mean, yeah, you're right, though. I mean, I would need a few days, because the kids, I mean, you know, who's gonna take care, I just need, by the end of the week, I can get something in place, so
Yeah,
as
take
long
whatever
as
time you
I
need.
need to have it done this week, though, because
Yeah.
I just can't
I know that we
keep
can.
going on. I mean, you know, just putting the kids to bed at night, I'm gonna be thinking, what if I'm not there for them? How can you not think of that?
Yeah, it's
I
tough.
mean, Sophie's only 5. Thank you.
That's definitely hard to think about.
Yeah. I don't wanna be a baby about it, but I'm thinking more of, like, my family, the impact on them. That's just such a shock. I mean, a few of my friends have had mothers that have been diagnosed with breast cancer, but nobody my age. I mean, no one in my family's ever had breast cancer, so I wasn't expecting it.
Yeah, unexpected and not something you were obviously hoping for, so I know it must be tough for you.
Yeah.
But why don't you, I think it will be good to take a few days, talk with your husband. It's good to have support
Yes.
and to have him here with you. I mean, if I do the procedure, I don't mind if he's in here. Depending on who you're with, they may ask him to stay out, but that's up to you
Time,
too.
please.
Okay.
So I think we'll get that scheduled for you right away.
All right.
Okay, and any questions you have between now and then, let me know.
Okay, I will do that. Thank you, Doctor.
Thank you so much. Sorry to have to give you this news, but we'll get you taken care of, okay?
I appreciate that.
Yeah.